At the back of a cave in the hills of northeastern Morocco lies a cemetery, and the people buried in it died about 15,000 years ago. When their teeth were examined, more than half of them were rotten. Out of 52 adults, only 3 had no cavities at all. The rest had decay and abscesses, and sockets that had closed over teeth lost years before death. These people were hunter-gatherers. Agriculture would not exist anywhere on Earth for another several thousand years. There was no sugar, no bread, no flour ground from cultivated wheat. What they had was acorns. They harvested them in bulk from the oaks around the cave, along with pine nuts, and processed them into something soft and sticky. Cooked acorn is a starch that clings to teeth and feeds the bacteria in the mouth, and those bacteria produce acid, and acid dissolves enamel. The rate of decay in that cemetery is comparable to a modern industrial population living on refined sugar. Before we continue, make sure to subscribe to the channel so you don't miss our future documentaries. Thank you for your support. Now, let's continue. So the first thing to abandon is the idea that people in the deep past had perfect teeth. Some populations did, many did not. But decay was not the main problem for most of human history. Where was? Everything people ate carried grit. Roots come out of the ground with sand in them. Seeds ground on a stone pick up particles of the stone itself. Meat cooked in ashes carries ash and dirt. Water came out of rivers and seeps and had sediment in it. Nothing was washed the way anything is washed today, and there was no way to remove the grit before eating. Children started with it too. A toddler eating mashed root off a stone was already taking in sand, and by the time that child was 10, the enamel was measurably worn. Nobody in the ancient world reached adulthood with a mouth that a modern dentist would call untouched. The result is that teeth wore down like a stone step in a doorway. By early adulthood, the peaks and valleys on a molar were flattened. By middle age, in many populations the molars were worn down to smooth discs, and in the worst cases the enamel was gone entirely, and the softer dentine underneath was cupped out. That is where the real danger started, because underneath the dentine is the pulp, and inside the pulp are the nerve and the blood supply. Once wear or decay opens a path to the pulp, bacteria get in. The tissue dies, the infection moves down through the root, and it collects at the tip in a pocket of pus pressing against bone. That is an abscess, and skulls from the deep past are full of them. On a jaw, an abscess shows up as a hole eaten through the bone where the pressure finally found a way out. There was nothing anyone could do about it. The pain of it is worth stopping on, because it is the one part of this that everyone alive can imagine. An abscessed tooth throbs with the pulse. It keeps a person awake for nights on end. It makes eating on that side impossible, radiates into the ear and the jaw and the side of the head, and swells the face until the eye closes. There was no aspirin, no ice, no way to numb it, and no expectation that it would end. A person in that condition still had to walk, gather, hunt, carry and keep working, because in a group of 30 people nobody can be carried for long. An abscess either drains, in which case the pain subsides and the infection becomes chronic, or it does not, in which case the infection spreads into the jaw, into the soft tissue of the face and neck, and eventually into the blood. Dying of a tooth was ordinary. It remained ordinary until well into the modern era, which explains what people were trying, because they were absolutely trying. The most common evidence is the toothpick, on teeth from all over the world, going back hundreds of thousands of years and including Neanderthals. There are small rounded grooves worn into the sides of the teeth right at the gum line. Those grooves come from something being pushed and worked back and forth in the same gap repeatedly, over a long period. A stiff grass stem, a splinter of bone, a thin twig. And the grooves are not random. They cluster around teeth that were already diseased, next to gums that had receded and bone that was inflamed. People were digging at the places that hurt. Chewing sticks were part of it too. A green twig chewed at one end frays into a brush, and plenty of the plants people chewed carry compounds that kill bacteria. Hardened plaque on ancient teeth has trapped traces of what went into the mouth, and in one case, on an individual with a serious dental abscess. It holds poplar, a tree whose bark contains the compound that modern aspirin is built from, along with a mould that produces a natural antibiotic. That may be coincidence. It may not. There is a broader point buried in that plaque. The same hardened deposit that ruins gums is also the best record anyone has of what went into ancient mouths, because it traps and seals whatever was being chewed and then fossilizes. Starch grains, plant fibers, wood, pollen, feathers and smoke particles all turn up in it. Every one of those mouths was carrying its own archive without knowing it. The mouth was also a tool, which made everything worse. In a group with no vices, no clamps, and no spare hands, the front teeth are the third hand. They hold while the hands work. Front teeth in many ancient populations show heavy rounding and chipping, and fine scratches running across the outer surface of the incisors, angled the way a stone blade cuts. The pattern comes from holding something in the teeth, hide or sinew or plant fibre, pulling it tight with one hand and cutting downward against it with a flint blade in the other. The blade occasionally hit the tooth. Hides were also softened by chewing, hour after hour, which wears the front teeth flat. In some groups, the front teeth of adults, especially women, are worn to a completely different shape than the back teeth because of it, and the wear starts young enough that it is visible in teenagers. Sinew was chewed to separate the fibres before it could be used as thread. Plant stems were chewed to soften them for cordage. Bone was gripped in the teeth while being cut. Every one of those jobs put pressure on teeth that were already grinding themselves away on sand. By the time a person reached 40, if they reached 40, the mouth was often a wreck. Teeth worn to the gum, several missing, gums receded, at least one chronic abscess. Gum disease did as much damage as decay. Plaque hardens along the gum line into a rough deposit that pushes the gum back, and once the gum retreats, the bone under it starts to dissolve. Ancient jaws show the process clearly, with the bone edge worn down and the roots of the teeth standing exposed. Teeth loosened, shifted, and eventually came out on their own, which was in some cases a mercy. And people survived that, which tells you something else. There are skulls of old individuals with almost every tooth lost long before death, and the sockets fully healed over, meaning years of living with no functional teeth at all. Somebody was pounding and mashing food for those people. A group that keeps a toothless elder alive is a group where somebody spends time every day preparing food that person can swallow. Then there is the deliberate work on teeth, which is much older than most people would guess. Some groups pulled healthy front teeth on purpose, as a marked practice performed at a particular age, and the people in that Moroccan cemetery did exactly that. Almost every adult in that cave is missing the same teeth, removed while they were alive and healthy. Doing it means somebody held the person, somebody worked the tooth loose, and everyone involved accepted the bleeding, the swelling, and the risk of the socket becoming infected. It hurt enormously, and it left the sockets to heal into smooth bone. Whatever it meant, it was a decision, repeated across generations, and it was almost certainly done to mark that a person had passed from one stage of life into another. And in a rock shelter in Tuscany, on a set of upper front teeth from about 13,000 years ago, both of the exposed pulp chambers had been widened from the outside before the person died. The inner surfaces carry striations from a pointed stone tool used in a rotating motion. Packed into one of the cavities were traces of bitumen along with plant fibres and hair. Somebody scraped out the dead tissue inside a living tooth and then filled the hole. That is dentistry, performed with a flint point, by firelight, with no anaesthetic of any kind on a patient who was awake. It got more systematic later. At a Neolithic settlement in what's now Pakistan, between 7,000 and 9,000 years ago, at least 9 people had molars drilled clean through the enamel, in holes up to about 1/8 of an inch across. The tool was almost certainly a small flint tip mounted in a bow drill, the same technology used to drill beads. Several of those people had the work done more than once. The detail that matters there is who did it. Drilling into a molar at the back of a living mouth, by daylight or firelight, without being able to see much, takes a steady hand and practice. In a settlement where 9 people received the same procedure, somebody had become the person who did teeth. That is one of the oldest specialised jobs anyone can point to, and a jaw from a site in the Alps, roughly 6,500 years old, has a cracked front tooth sealed with beeswax, applied while the person was still alive. None of that stopped what was coming. When agriculture arrived, decay went from a regional problem to a universal one. A diet built on ground cereal is a diet of soft, sticky carbohydrate, eaten several times a day, and the mouths of farming populations rot at rates their hunting and gathering ancestors would not have recognised. Skulls from early farming villages are markedly worse than skulls from the foragers who preceded them in the same valleys. The jaws changed shape as well. Softer food means less chewing means a smaller jaw, and the teeth stayed the same size. Crowded, crooked and impacted teeth are largely a problem of the last 10,000 years, which is why wisdom teeth that fit comfortably in an ancient jaw have nowhere to go in a modern one. So the honest summary is this. Before farming, cavities were less common in most places but not absent, and where the local staple was starchy and sticky, they were as common as they are now. Wear was universal. Abscesses were routine, painful for months or years, and sometimes fatal. There was no way to numb anything, no way to kill an infection, and no way to replace what was lost. And people worked on it anyway, with sticks and grass stems and chewed twigs and flint points, for tens of thousands of years, because a tooth that hurts is impossible to ignore. The people who painted the walls of caves in Europe were, on average, in their 20s and 30s. A good number of them were doing it with an abscess.